Pretty much everybody after the age of 30 or 40 would love to tighten their skin, but most of us don't want to have surgery to get there. So on this podcast, I'm going to give you all the different ways that you can tighten up your skin without going under the knife. These are treatments that you can do at home, in the office, and none of them involve actual surgery. Okay, so today's podcast is all about how to tighten up skin. I'm 53. And I'm noticing, yes, my skin is not as tight as it used to be. And there's certain things that I do to help keep my skin tight and hopefully youthful. Because no, I don't want skin to sag, especially on my neck, jowls, and all of that. So I'm going to tell you what I'm doing with my skin, as well as give you other options, some things that I haven't done, but I've learned about. And we're going to go from basically least invasive to more invasive. So the first thing, and you've probably heard this from a lot of people, is to apply retinol. Retinol is the gold standard for anti-aging, over-the-counter skincare ingredients. It helps to exfoliate the skin. It can help to create some mild skin tightening. It can thicken the dermis, or the deeper layers of the skin. It can help to improve fine lines and wrinkles. There's so many things that it really can do. Now, I'll tell you though, retinol can be irritating for some people, and I have pretty sensitive skin, so I use my Youn Beauty Peptide and Bakuchiol moisturizer. There is a small study that compared Bakuchiol to retinol and found fairly similar anti-aging benefits. And then peptides are short chains of proteins that can signal our cells to create more collagen. And so for me, I actually don't use retinol, although once again, I'm a huge fan of it because so many people use it and do so great with it. I just have more sensitive skin, and so I use our Peptide and Bakuchiol moisturizer on my skin. But if you don't have sensitive skin like me, then I would go with the retinol first, because that is the most proven. Most dermatologists and plastic surgeons will tell you, go with the retinoid over growth factors, over Bakuchiol, over peptides, because we know that those are proven and they work. Better yet, you can do both. That's another option for you as well. Those are things that can help just long-term to improve the collagen of your skin. It's not going to be an instant tightening of your skin. But if you are looking for instant tightening, there are serums and creams out there that can actually do that. And they function basically as creams that you put on your skin. And when those creams dry, they become a film, and that film can essentially contract. And what that can do is it can cause the skin to look and feel tighter. There are a lot of these online. There's one that Peter Thomas Roth has. I mentioned it in a recent podcast that you can use for around the eyes, called the Instant Firm XI. But there are other ones that are made that you can put on other parts of the face as well to create some mild instant tightening. Now, the problem with these creams and why they're not super popular is because they'll last for maybe an hour or two, and then they tend to wear off, and then you're back to looking how you used to before. So these are not ways to reverse aging, but just to temporarily give you a quick fix so you can look tighter for a short period of time. So that's another option for you. Okay, now let's get into the actual treatments. The first one, and this one is creating a lot of waves out on social media, is called XERF. Now you can spell it as XERF. I think it's pronounced XERF. That's what I call it, but it's fairly new. This is a radio frequency device that originally got its approval in Korea, where a lot of people used it, and more recently has gotten FDA approval. And so this is getting more and more popular here in the United States. And what this essentially does is it is a non-invasive treatment. Supposedly has very minimal discomfort to it, where it uses radio frequency energy to pass through the surface of the skin and to heat the deeper skin itself. Some people say that it feels like a hot stone put on your skin, but it doesn't feel like it's burning or anything like that. Other people do say that they have some mild discomfort from it. But this is a completely non-invasive treatment that essentially uses radio frequency energy to heat up the deep skin. Now, radio frequency to heat the skin has been around for a long time. Back in the early 2000s, Thermage was the first one that was radio frequency heating of the skin. And it was actually featured on the Oprah Winfrey Show back when her talk show was massive back then. And a lot of people bought it. A lot of people had it done. The problem with thermage is it's what we call monopolar frequency. So it only goes to one certain depth. And I actually wrote a letter in our white journal, our Plastic and Reconstructive Surgery journal, way back, I think it was like in 2005, showing that there are some people who are complaining that those radio frequency waves went too deep and actually caused fat loss in some people. So that was one of the early criticisms of thermage. My understanding is since then, the settings have been changed and fat loss is a really unusual consequence of the treatment. Well, the idea of XERF is that now you're doing two different frequencies. And so it uses two radio frequency treatments. So they say that you can treat both the superficial skin and the deep skin at the same time. Doing this, the idea is that you can get more heating of that skin, superficial and deep. That can create more of the tightening effect as well. Now, XERF treatments technically have no downtime, and they do recommend typically two treatments that you want to space a few months apart. And usually the practitioners recommend 2 to 3 treatments a year to maintain the results. So that's quite a bit. Okay, so you want to start off with 2 treatments, you space them out a month or 2 apart, and then you want to do 2 or 3 treatments a year, so one every 4 to 6 months to keep those results up. Once again, big thing about this, absolutely no downtime. A lot of people say there's pretty much no pain associated with it. It's kind of a deep heating of the skin that's not super uncomfortable. The negative in general, we had a device like this in my office many years ago called Refirm, and that used radio frequency energy to try to heat the deeper skin. And it worked okay. The good thing about it, it was not painful, super easy to have done, 0 downtime to it. So much like what you hear about XERF, but the results were very, very modest. Really so modest that it was hard in some patients to even see the result much. We do not do Refirm anymore. It's kind of old technology now. I actually sold that device on eBay, I think for like $3,000, maybe a year or 2 ago. So I no longer even have it in my office. But now we have progressed to some other things. I'm going to cover what we're doing in my office very shortly. But XERF is right now a very hot topic in social media. I was just on actually a buddy of mine, Dr. Christian Subio. He's a plastic surgeon in Philadelphia, and he has an actual app that's a social media app for injectors and estheticians and plastic surgeons, dermatologists, for people who are in the aesthetics field. And there was actually some people asking about XERF, and a lot of people leaving their comments that they see really nice results in their patients that you can even see in photographs. I find that kind of hard to believe, but if that's true, then you could get a really nice result with it. I don't have any experience with XERF. I'm interested in learning a little bit more about it. If you have experience in XERF and want to share your story, definitely leave a comment on my social media channels because I would love to hear what you think about it. So that's XERF. That's probably the least invasive of these treatments that we're going to talk about today. Once again, no downtime to it, but also potentially the least results when you compare it to some of these other treatments coming up. Okay, so the next level of treatments that will help to tighten up your skin is ultrasound-based treatments. The original one is called Ultherapy. Ultherapy has been FDA approved for God knows how many years, at least 10 years, probably more like 12 or maybe like 12 years is my guess. But what it is essentially is it is ultrasound energy that is turned way up. Same ultrasound that you can look into a mom's belly and see a little baby inside. But if you turn that ultrasound way up and you target it to the deep skin, you can create deep heating of that skin. And like the radiofrequency XERF treatment, you can deep heat that skin and cause that skin to tighten. Okay. Now the benefit of Ultherapy, like XERF, is it's non-invasive, completely non-invasive. There's no poking, no needles, nothing like that. It definitely works. It definitely heats up that deep skin, and you can see reasonable changes in a lot of patients. The negative with Ultherapy, and this is what I hear from a lot of people, is that it's quite painful. And you can't numb the area up unless you're using injections or sedation or something like that. Because if you apply numbing cream on the surface of the skin, that does not numb up the deep skin. It just numbs up the surface of the skin. And the Ultherapy, those ultrasound waves, target the deep skin, not the surface of the skin. And so you can't really numb it up using a topical. And so it's deep heating of that skin that some people say does feel, in some cases, quite uncomfortable. I heard one person, and I don't remember who it was, I think it was a patient of mine, described it like you're putting a hot iron on your face, which that does not sound like fun. But it does work. I think that probably, if you're looking at patients who have really dark skin, so Fitzpatrick types like 5 and 6, then this is going to be the gold standard currently for skin tightening because it is colorblind. It bypasses the upper layer of skin, so you don't have issues with pigmentation problems due to inflammation afterwards. But if you have lighter skin, if you're Fitzpatrick 1 to 4, maybe even 5, then it's not necessarily, in my opinion, the gold standard anymore. If you've been listening to me for a while, you know that I'm a big fan of collagen supplements and what they do for your skin, hair, nails, and joints. Quince Collagen Peptides Plus combines collagen, hyaluronic acid, and vitamin C to provide glowing wellness benefits and address visible signs of aging from the inside out. The addition of vitamin C helps support your body's natural collagen production, and hyaluronic acid helps with your skin's hydration and elasticity. It's made in the USA with grass-fed, pasture-raised collagen peptides, and it supports your skin, hair, nails, and joints. It's unflavored and easy to mix into whatever you're already drinking. Coffee, smoothies, or even just water. So it doesn't feel like an extra step. And like everything Quince does, it's thoughtfully made and priced really well. At $30 for 30 servings, it's less than half of the leading collagen brands. Quince works directly with trusted manufacturers, so you're getting premium wellness ingredients without the inflated markup. Well, add something simple to your routine. Go to quince.com/Dr. Youn for free shipping on your order and 365-day returns. That's quince.com/Dr. Youn for free shipping and 365-day returns. Quince.com/DRYOUN. These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. I've tried so many electrolyte brands over the years, and Cure is hands down the best tasting one. I've always wanted something that was clean, and that's one of my favorite things about Cure. It's their ingredients. It's basically coconut water and pink Himalayan salt doing the work, not sugar. There's also no artificial sweeteners and nothing that you can't pronounce. And I'd say that it's not too sweet and not too salty. It tastes like actual fruit, but without that artificial aftertaste. And it comes in a ton of flavors, like peach mango, berry pomegranate, watermelon lemonade, strawberry kiwi, ginger turmeric, blood orange, and tropical punch. Well, if you're not sure which one to try, then grab the variety pack so you can try a bunch of them. Well, Cure's the electrolyte mix that I've started reaching for daily. With clean ingredients and nothing artificial, it's become easy to stay hydrated. Find it on Amazon or save 20% at curehydration.com with the code Dr. Youn. That's curehydration.com with the code DRYOUN to save 20%. Another type of ultrasound device that's super popular right now, and in my opinion has overtaken Thermage as the preeminent ultrasound-based skin tightening treatment, is SoftWave. SoftWave also uses ultrasound energy to heat up the deep skin to create tightening of that skin. And I've heard people tell me some really nice results with this treatment. Supposedly, they have cracked the code and it's not that painful. I've never done it. I've never had it done, so I can't tell you for sure, but this is what I'm hearing through the grapevine, is that SoftWave essentially works very similarly to therapy, using ultrasound to heat the deep skin, but cracking that code so it's not so painful. I was talking to a plastic surgeon recently who was telling me that he sees great results with this SoftWave. Once again, I haven't used it, so I can't tell you for sure. Definitely if you have darker skin, once again, Fitzpatrick type 5-6, if you've got darker skin and you want to get some tightening, then looking into SoftWave, oral therapy, or both is probably what I would recommend, because this is going to be safe for your skin type. Now, what are some bad things other than the potential pain of it? Well, there's a risk of potential fat loss. Like I mentioned earlier with Thermage, if you target the deep skin and you heat it up, and let's say you get some of that heat gets dissipated into the subcutaneous fat below that skin layer, it's possible that some of that fat could actually melt. It can actually die. The fat underneath our skin is less hardy than the skin itself. And so what the skin can potentially tolerate, the fat underneath it may not. And there are potential reports of people who are getting these ultrasound-based treatments who say that they have experienced some potential fat loss from them. So that is a potential complication or side effect that you definitely want to discuss with whoever's doing this treatment. A big benefit of Ultherapy and SoftWave is that unlike XERF, where you have to do 2 treatments, you space them a month or 2 apart, and then you do these kind of frequent treatments a couple times a year, with Ultherapy and SoftWave, the idea is that you're one and done. This is not something that you have to do a bunch of times, especially with Ultherapy. It's like one and done, that's it. And so that's a good thing. And some people will try to reduce the discomfort with these procedures by using things like Pronox, which is nitrous, that doesn't take away pain, but gets you kind of a little high so you don't care about the pain as much. That is Ultherapy and SoftWave. We're going to move up a step now. So we're still not invasive yet, but we're going to start getting a little more aggressive. And that's with the fractional lasers. So let me describe what fractional lasers are. So the old lasers, the CO2 lasers, are what we call ablative. So if you had a laser treatment, let's say in the 90s, they would take a CO2 laser where the target of that laser is water. And it essentially causes water to burn. Okay. Our body is what, like 75% water or something like that. And so if you were to target the skin, it targets water, it burns the skin and the water, and essentially it burns the whole upper surface of skin off. And this works really well for people who have severe conditions, severe acne scarring, really bad lines and wrinkles. Then doing an ablative CO2 laser treatment where you literally burn all the skin off your face can be very effective. But the problem with this treatment, as you can imagine, is it's quite painful. The downtime is quite intense, and you are literally a burn patient for a week or two. It takes at least usually 2 weeks for that skin to completely heal back. And so in the meantime, you're oozing, you look terrible, you're all swollen, and it's just not fun. So those lasers are not being used all that often anymore. Some doctors are still doing it, but most doctors have gone over to fractional lasers. So the way to describe fractional lasers is that instead of burning all the skin off your face, you can burn a fraction of the skin off your face. Another term for this is like a pixelated laser. And you may have seen on social media people doing laser treatments. It looks like tons of tiny little dots on the face. Well, that is fractional laser. And so what they're doing is instead of just leveling the whole skin and just burning all the skin off, you are burning tiny columns into the skin, okay, at certain intervals. And as it heals, you get a similar effect as if you burned all the skin off your face, but you usually have to do it more than once to get maximal effect of that. So the benefit is it's less painful. Recovery is a whole lot easier. It's less expensive. You don't have, all this oozing and everything afterwards, and it's safer. You have a lower risk of complications, but the negative of these fractional laser treatments is that you typically need to do a couple of them to get a similar result as one of the ablative laser treatments. Now, what fractional laser does is it can help with overall skin rejuvenation. It can help with fine lines and wrinkles. It can help with spots. It can help with the overall surface of the skin to smooth it out. But it can also create some tightening of the skin. I actually had an employee of mine many years ago who actually came to work one day, and I looked at her and I thought, dang, she got her eyelids done. And I didn't do them. Why would she have her eyelids done and not ask me to do them? She works for me. She's my employee. And so it kind of hurt my feelings a little bit. And I never said anything to her, but I found out later she didn't have her eyelids done. She had fractional laser resurfacing done to her upper eyelids. And that's why, and it tightened up the skin and it made it literally look like she had her eyelids done. So she did not betray me as a surgeon. This was a laser treatment that really created a nice effect for her. And so if you've got some loose skin, fractional lasers are definitely an option. You will get some downtime with them. You will get other impacts that are nice, with resurfacing of the skin that you don't get, let's say, with Ultherapy or SoftWave or XERF. But it's also a little more invasive. So there is going to be some downtime with this, unlike with some of the treatments that I've mentioned so far. The fractional lasers, in some ways, I look at them as kind of like a jack of all trades when you're talking about skin treatments, because it kind of does a bit of everything. Once again, it can help with fine lines. It can help with skin tightness. It can help with age spots. It can help with sagging of the skin. It really can do a lot of things, kind of like if you're applying a retinol, but obviously this is much, much more potent. Okay, so working our way up, we just talked about fractional laser. What's the next step up if you're looking for tightening of the skin that is non-surgical? And this is what I get done. And it's RF microneedling. So what is RF microneedling? Well, RF microneedling stands for radio frequency microneedling. And I mentioned earlier when we talked about XERF, how XERF uses radio frequency energy to heat up the deep skin, but it does that completely non-invasively. RF microneedling does that, but it's minimally invasive. And so what it does is it takes needles, and these needles are insulated all the way up to the tip. Those needles are used then to puncture the skin, and when the needle is at its deepest point in the skin, it emits radio frequency energy from the tip of that needle, or heat. So it heats up that deep skin directly using that insulated needle that's insulated once again all the way up until the tip. The tip is not insulated. So the needle goes into your skin, emits a radio frequency energy or heat, and then comes out. And you do that throughout the whole face. So what this does is it's a twofer. You get the benefit of the needle poke. Microneedling itself is done where all you do is you poke the skin with the needles, and that in and of itself creates microtraumas to the skin. That microtrauma can cause the skin to actually tighten up. As the collagen heals together, it heals up in a tighter fashion. So you can get that just with the microneedling, but if you add radio frequency to it, you get even more, and that's that deep heating of the skin. So the most popular one is what we have in my office called Morpheus 8. And I have that done to my lower face and my neck really every 4 to 6 months to try to keep that area nice and tight. Now I'm 53 and it's still pretty tight for me. At some point, it's not going to do it. I'm not going to be 75 and that skin's still going to be tight, okay? It's preventative, it can help, but it can't stop the clock. That being said, it can definitely help. And in some people, what we usually recommend is a series of 3 or 4 treatments starting out, each spaced out by about a month or so apart to get the maximal result initially. And then we do recommend maybe 1 treatment every 6 months or so, maybe once a 6 months or once every year. And that can help keep that tightness up. Now, once again, this is more invasive than XERF, so I would expect it should get more or better result than XERF. It is not completely colorblind like the ultrasound-based treatments. So usually if you're Fitzpatrick type 1 to 4, maybe 5, it's definitely, should be very safe to do it. But you shouldn't necessarily do it on people with really dark skin because it could potentially create pigmentation issues. And also, like with the Ultherapy, there is a potential risk of fat loss. If somebody turns a machine way up and they use a very long needle, and that needle goes really deep in your skin, close to the fat, and then heats that up, then yes, it's theoretically possible you can get fat loss from it. Now, I'll tell you, in my office, we do Morpheus 8 treatments pretty much every day, and we have not, in the many, many years of doing this, ever had a patient come back and say, look, I lost a ton of fat in my face. But we're also careful with it. We don't use super, super high settings. We don't use super, super deep needles. We really treat patients, I think, overall fairly conservatively, but they still get a really nice result with it. And like I said, that's what I use for my neck myself. So RF microneedling, in my opinion, currently is the gold standard for minimally non-invasive skin tightening in the office setting. There is no real downtime from it. You may be red for a day or two. We are using topical exosomes at Youn Plastic Surgery to reduce that redness pretty quickly. I find that when I get the Morpheus 8, I'm literally red for maybe a day, and that's it. The exosomes may help with that as well. So we use plated exosomes. It's from platelets, and that's something that we offer here at Youn Plastic Surgery. Summer is the season where everyone starts thinking about feeling a little more confident in their skin, whether that means getting back into a routine or just wanting to look a little more sculpted. Well, that's where iRestore's new Sculpt LED belt comes in. This premium wearable LED belt is proven to help support firmer-looking skin and aid post-exercise recovery, all from the comfort of your home. Wrap it around your waist, hips, thighs, back, shoulder, or knees. Choose your brightness and session time and let the belt do the work while you're answering emails, watching TV, or just winding down for the night. Using advanced triple wave LED technology and 1,260 medical-grade LEDs, the Sculpt LED belt supports smoother-looking skin, circulation, muscle relaxation, and post-workout recovery. It's flexible, comfortable, and easy to customize with 10, 20, and 30-minute sessions. Plus, with the optional battery pack, you can make your treatments cordless and even easier to fit into your day. It's the kind of wellness upgrade that actually fits into your day. Just wrap, relax, and let your routine do more for you. Take advantage of Iris Labor Day savings with huge discounts on their new Sculpt LED belt. Bring body-focused light therapy into your routine and feel more confident in your skin, all from the comfort of home. Just head to irisstore.com and use the code Dr. Youn. That's DRYOUN at irisstore.com. Please support my show and tell them that I sent you. Now we've gotten into the RF microneedling, so we're putting the needles in the skin, so we're starting to be a little bit invasive. There is a next step up from there, and that step up is minimally invasive treatments. Now, technically, you can say this is surgery, but this is not like facelift type surgery. So there are treatments out there. The original one is probably face tight and body tight. And what they are, it's kind of similar to what we used to do with laser liposuction. So there's always been this belief that doctors have had and that these laser companies have, that if you can heat the skin from the inside out, you'll get more tightening than if you heat it from the outside in. So once again, XERF, outside in skin heating, okay? You're not even touching the skin on the inside, but you're using radio frequency to bypass the skin to try to heat the deep skin. RF microneedling, you get that needle right where you want it, and it emits that radio frequency energy or heat. But there are treatments now will actually go underneath the skin to heat the skin up from the inside. And the original one was probably actually smart lipo, which was laser-assisted liposuction, where you numb up an area of skin, you make a tiny little incision, and then you stick the laser probe underneath the skin, and that laser literally looks like almost like a very, very small liposuction cannula, but kind of like a long little rod, very narrow rod that has a light on the end that emits a laser, essentially. And so what it would do is you would run it underneath the surface of the skin. That laser would then target the skin on the inside and create heat from that laser. And the idea is if you heat the skin from the inside, you can cause that skin to tighten up even more aggressively than if you try to do it from the outside. Well, not surprisingly, laser lipo didn't work very well. At one point in time, there were probably 8 or 10 laser lipo devices on the market, and now I don't even know if there's any. There might be one. Smart lipo might still be out there. I'm not sure. But if it is, not a ton of people are buying it because it's considered now to be a bit of old-fashioned energy device. So the latest version of that, where you stick a probe under the skin and you heat the skin up, probably started off with face tight and body tight. And this is from the same company that makes Morpheus 8, where essentially what you do is it looks like a long needle, honestly, but it's like a radio frequency probe that you put underneath the surface of the skin. You have to numb the area up first, okay, because you're not going to tolerate this going under your skin. And then it also has a paddle on the surface of the skin. And the idea is that you are doing two things. You're heating the skin with radio frequency energy from the surface using this paddle that's on the surface of the skin, and you're also heating the skin from the inside using that radio frequency probe. Once again, this is minimally invasive surgery because you got to numb the area up, make a little incision, and stick it underneath. And the idea now is you're kind of sandwiching the skin with this radio frequency energy to try to cause that skin to tighten up. Face tight is a small version of it that you can use on the face and like in the neck. Body tight is a larger version of it that you can use on the body. I've never done it. I have seen it done before. I've talked to patients who've had it done. Results, my understanding, are kind of so-so. I think you get much better result in a smaller area, like let's say underneath the chin and the neck area. Not as impressive if you're doing, let's say, the thighs or the entire abdomen. What came out after face tight and body tight is Renuvion. Renuvion was also called J-plasma. And what that uses is plasma energy to also stick a probe under the skin. That emits plasma energy to heat the skin once again from the inside. I actually looked at this when it was called J-plasma, its kind of first iteration of it, and it scared the bejesus out of me. And it did, because on the inside, it literally looked like a flamethrower on the inside. Now, it's not a flamethrower. It's not a flame. It's plasma energy but to me, it looked like almost like a flamethrower. So I didn't do it. I have friends of mine who are doing Renuvion. Some of the before and after photos look pretty darn impressive. But it's that same idea that you're heating that skin from the inside. It is minimally invasive surgical procedure because you got to numb the area up. You can't just do it with topical or something like that. And the idea, once again, is heating that skin up from the inside. Well, there is a new one now that's making waves called Quantum RF. And my understanding is that Quantum RF is the more advanced version now of face tight. So Quantum RF uses a probe that goes under the surface of the skin to once again heat that skin from the inside out. And supposedly, this device is more accurate, it uses more power, and you can get potentially better results. Once again, I have not used quantum RF. I've heard some really good things about it. But this now, if you're going to consider doing a minimally invasive skin tightening treatment like that, you want to get better results than you can get from, let's say, RF microneedling, then these are some treatments to consider. Quantum RF probably, because that's the newest version of the FaceTite, or Renuvion. I know that there have been some legal issues with Renuvion advertising, so I'm not sure kind of what the legality of it to advertise it cosmetically, but that's something that, once again, I've seen that does appear to seem to work quite well. And there's one final one for you to consider if you're thinking about skin laxity. When we think about skin laxity, excess skin, and wanting to tighten that skin up as surgeons, we think about cutting the skin out. And if I do a facelift on a patient, I may remove a centimeter of width of skin from a person's face. If I do a tummy tuck, I may remove many, many centimeters of excess skin to try to help flatten out the abdomen. Well, what we're doing is we are removing skin, excess skin. And by removing that excess skin, there's less skin there afterwards, and it's going to feel tighter. So there's a company that took that idea, and what they're doing is what's called microcoring. And what it is essentially there are large needles that are hollow, and these needles are hooked up to a suction. And this handheld device, then, you have to be anesthetized for it. You got to, have local anesthetic injected to numb the area up because these are big needles. When they poke into your skin and come out, they take out a microcore of skin with it. Okay, so the needle is hollow. It's attached to suction. Needle goes into your skin. Because there's suction attached to it, your skin, a tiny core of skin will go up that needle. And when you pull the needle out, then that skin is basically removed. So that may be a fraction of a millimeter of skin. But if you do that hundreds of times, okay, which can be possible if the area is numbed up, then hundreds of times versus half a millimeter can add up after a while. And the idea then is that you can, by making such small microcores, you're not creating visible scarring on the skin, but you are, when you add it all up, removing an actual amount of surface area of skin from that area, cause that area to essentially tighten. It is a great idea. It's something that I think in the future could take the place of certain types of excision operations. But, and I'm sorry, this is a big but, I've seen some of the before and afters of this, and it's a company called Ellacor, and the before and afters haven't been all that impressive, unfortunately. So at this point, I'm still waiting on it. I think it's really interesting technology. I think it's got a lot of potential. I'm not sure how you can take that and make it even better other than doing even more, pokes into the skin. But I'm sure they're working on that because I'm sure that if this does really what it, I think, theoretically could do, that could be really, really impressive for our patients. These are different ways for you to tighten your skin without surgery. Start off with the retinol, the bakuchiol, the peptide moisturizers. If you want to take the next step from there, then you can look at XERF as a non-invasive treatment. You can come see us in my office for some Morpheus 8 if you want to do what I do, or you can even consider actual surgical treatments if you want to go down that route. So I hope this was helpful for you. My name is Dr. Anthony Youn. This is the Dr. Youn Show. If you've enjoyed this podcast, if you could take 2 minutes of your time to leave a rating or review on iTunes or Spotify or wherever you get your podcasts, it really does help me spread the word. And every week I'll give a quick shout out to somebody who does. All right, so thank you so much, everybody, for watching and listening. I'll leave you with this: adopt, don't shop, save a life today. Thank you very much, everybody.